This is Dr. Michael Bold. Thanks for watching. I take great pride in doing the best job I can to helping people find and meet their potential with their eyes. Just want you to experience, the best vision you can in the distance and up close, and whether that be with glasses or contacts. You may not realize that one eye sees better than the other. You may not realize that you're working too hard to read, or you really should have glasses in your distance, or that your child should have glasses, and you think that because they're not telling you that they're seeing just like you do. But it's really important, even from a very young age to a very older age, that you address your eyes not only on the outside of how you see, but also on the inside. So we look at the complete eye health from looking at glaucoma and cataracts and macular degeneration issues and diabetes issues, and we just want to make sure that your eye is healthy on the inside as it is on the outside. So anything that you have that is of a concern that you can notice and feel may not be the complete picture of your eyes. There may be things going on inside the eyes that you don't have any idea that are there. Understand, but that's where I want to bring out in these segments that there are things that are very important going on inside the eyes that you want to know, coming into an eye exam. Is this in my family history? Is this something that could happen to me? These are all things that, we'd like to just dispel fears. And when people say that there's a certain period of time before this is really going to be a problem, that may not be a problem in that time at all. Nobody should live with a cloud over their head that they think that, well, they only have so much time before they have to deal with cataracts, or they have to deal with, my mother had this problem and it's going to happen to me. It's so individualistic, but in these segments we want to bring out at least some of the areas that will open a dialogue to say, what, gosh, that was a concern of mine that now it's not as much of a concern because Dr. Bold addressed those areas. So I hope that in some of these segments coming up we can try to alleviate some of the main questions and concerns people have about their eye health. There's a world of questions, but we hope to try to get as many as we can in. And if you have questions, you can email them to us, and just looking forward to making every future segment better than the last. And we're just try to get all the information that we can out there for people, and those that live close by that want to come in, we treat you as an individual. We give you the individual time, and we just want you to be happy through the whole experience. And no matter if I see you in the store or anywhere, I want you to be able to feel like you can come up to me and say, hey, that was a great eye exam, and I'm seeing the best that I ever have. So that really brings out a lot of joy in my heart, where I can see that I can help people. And even when they're very young and they can't speak for themselves to say, hey, this is really bothering me, because they don't know how they're supposed to see. Sometimes they're fearful to tell their parents of how they see. So all of those kind of things I look forward to bringing out in future segments, and just want to let you know that your eyes are so valuable, and people take their vision for granted every day. And just to lose one day of somebody's eyesight, it's tragic. And we have seen people have great experiences and get the kind of vision that they've always want to have. But you gotta look for the warning signs. You gotta look at the family history. You have to be knowing that are these groups of medications a good thing for me or a bad thing in terms of side effects with the eyes. All of those things we bring out in the eye exams, and that's where with some of the question and answer segments, we hope we can bring out some of those. But if you have email questions, or you can come in for an exam at any of our locations and try to we'll give you the one-on-one attention and really give you a good quality eye exam. Look forward to seeing you in the future. I want you to see your best. Take care.